Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study published in the Journal of Veterinary Internal Medicine in 2024. This research, conducted by a team of dedicated scientists, including Sophie Mary Neeson and colleagues from Ghent University and Sonic Healthcare Benelux, explores the important topic of kidney function assessment in our aging canine companions. As our dogs gracefully enter their senior years, just like humans, they can experience changes in their organ function. One area of particular focus in veterinary medicine is the health of their kidneys. Early detection of any decline in kidney function is paramount. Recognizing problems early allows veterinarians to implement timely preventive strategies and appropriate treatments, ultimately aiming to improve the long-term well-being and quality of life for these cherished animals. For many years, a substance called serum creatinine has been a cornerstone in screening for renal or kidney dysfunction in both human and veterinary patients. However, scientists have been continuously searching for additional tools that might offer even earlier or more nuanced insights into kidney health. This is where serum symmetric dimethylarginine, often abbreviated as SDMA, has emerged as a promising biomarker. It appears that measuring the concentration of the substance in the blood could provide valuable information, potentially even before changes in serum creatinine become apparent. The research we are discussing today highlights that the gold standard technique for precisely measuring serum symmetric dimethylarginine is a sophisticated method known as liquid chromatography-tandem mass spectrometry, often referred to as LC-MS/MS. This technique is highly accurate and is considered the most reliable way to quantify symmetric dimethylarginine in the blood of small animals. However, the availability of this advanced technology is not widespread in routine veterinary practice. In contrast, a different method called enzyme-linked immunosorbent assay, or ELISA, is more commonly used in veterinary laboratories for measuring symmetric dimethylarginine, particularly a commercially available test from IDEXX laboratories. While both methods offer similar ease of use and speed in terms of workflow, the technology required for enzyme-linked immunosorbent assays is more readily accessible. Several recent studies have investigated how well the IDEXX enzyme-linked immunosorbent assay performs in comparison to traditional markers like serum creatinine in detecting a reduction in the glomerular filtration rate, which is a key measure of how well the kidneys are filtering waste products from the blood. Some research in dogs has suggested a cutoff value of 16 micrograms per deciliter for the enzyme-linked immunosorbent assay to optimally identify a decreased glomerular filtration rate. Another study proposed an even higher cutoff of 18 micrograms per deciliter for detecting a significant reduction of 40% or more in glomerular filtration rate. Interestingly, these suggested cutoff values are notably higher than the upper limit of the general reference interval, which is often stated as greater than 14 micrograms per deciliter for the IDEXX symmetric dimethylarginine test. This discrepancy raises questions about the interpretation of symmetric dimethylarginine results obtained using the enzyme-linked immunosorbent assay. Furthermore, previous research has indicated a degree of analytical variability associated with the IDEXX symmetric dimethylarginine test in cats. A comparative study in dogs also found a considerable difference between results obtained using a point-of-care analyzer and the commercial laboratory IDEXX symmetric dimethylarginine test. While the biological variability of symmetric dimethylarginine in dogs over a longer period appears to be relatively small, the potential influence of interfering substances in the blood, such as products of red blood cell breakdown known as hemolysis, fat particles called lipemia, and bilirubin from liver metabolism, as well as another related substance called asymmetric dimethylarginine. Symmetric dimethylarginine measurements has been explored primarily for liquid chromatography-tandem mass spectrometry. Although it is often stated that the IDEXX symmetric dimethylarginine test is not affected by mild to moderate hemolysis or any level of lipemia or jaundice, the scientific evidence supporting these claims has, to the researchers' knowledge, not been formally published in peer-reviewed scientific literature. This lack of published data underscores the need for further investigation into the factors that might influence the accuracy and reliability of the widely used enzyme-linked immunosorbent assay for symmetric dimethylarginine. Another important consideration, and a central focus of the study, is the issue of age-specific reference intervals. In young, growing animals, establishing reference intervals that take their developmental stage into account is a well-accepted practice. Similarly, health screening studies in older dogs and cats have highlighted the importance of having reference intervals that are specific to these life stages. This is because the aging process can lead to various physiological changes that might affect the levels of certain substances in the blood without necessarily indicating a disease state. Currently, the IDEX symmetric dimethylarginine method provides an age-specific reference interval only for puppies, with a range of 0 to 16 micrograms per deciliter, but lacks such guidelines for older dogs. Given these considerations, the primary objectives of this prospective study were threefold. First, the researchers aimed to rigorously validate a liquid chromatography-tandem mass spectrometry method for measuring both serum symmetric dimethylarginine and another related compound, asymmetric dimethylarginine, in dogs. This method is routinely employed in a commercial laboratory. Second, they sought to directly compare the symmetric dimethylarginine results obtained using this validated liquid chromatography-tandem mass spectrometry method with those from the IDEX symmetric dimethylarginine test, which utilizes an enzyme-linked immunosorbent assay. In this comparison, they also intended to assess whether factors like hemolysis, lipemia, and the concentration of asymmetric dimethylarginine could influence any differences observed between the two measurement techniques. Finally, the third key objective was to establish age-specific reference intervals for serum symmetric dimethylarginine in older dogs using both the liquid chromatography-tandem mass spectrometry and the enzyme-linked immunosorbent assay methods. The research team meticulously collected and analyzed serum samples from a group of 121 older dogs. These dogs were participating in a larger ongoing study focused on health screening. The age criteria for inclusion in the study were based on a previously published analogy between human and pet aging. The dogs underwent comprehensive health evaluations, including blood pressure measurements, physical examinations, complete blood counts, serum biochemistry profiles, and urinalysis. To be included, the dogs were considered healthy by their owners and had not received any treatments for 2 months prior to the health assessments. For a subset of these dogs, a specialized test called the plasma exogenous creatinine clearance time test was performed to estimate their glomerular filtration rate, providing a more direct measure of kidney function. The liquid chromatography-tandem mass spectrometry method used in the study for measuring symmetric and asymmetric dimethylarginine underwent thorough analytical validation to ensure its accuracy and reliability. This involved determining the limit of detection, precision, linearity, and potential for carryover. The enzyme-linked immunosorbent assay measurements were performed at the IDEX Bioanalytics Laboratory. Now, let's turn our attention to the results of this important study. The analytical validation confirmed that the liquid chromatography-tandem mass spectrometry method demonstrated good linearity and precision, with the researchers establishing a laboratory reference interval for symmetric dimethylarginine using this method between 8.0 and 14.0 micrograms per deciliter. When comparing the two methods, the researchers obtained paired symmetric dimethylarginine measurements from 118 of the dogs. They found a significant difference between the results. The median symmetric dimethylarginine concentration measured by liquid chromatography-tandem mass spectrometry was 9.4 micrograms per deciliter, while the median concentration obtained using the enzyme-linked immunosorbent assay was significantly higher at 12.0 micrograms per deciliter. The average difference between the two methods was 2.2 micrograms per deciliter. Furthermore, the study established age-specific reference intervals for older dogs. Using liquid chromatography-tandem mass spectrometry, the reference interval was found to be 4.4 to 15.0 micrograms per deciliter. For the enzyme-linked immunosorbent assay, the age-specific reference interval was 6.4 to 17.4 micrograms per deciliter. It is crucial to note that these age-specific upper limits are notably higher than the general laboratory upper limit of 14 micrograms per deciliter often associated with symmetric dimethylarginine measurements. The researchers also investigated the potential influence of various factors on the difference between the symmetric dimethylarginine measurements obtained by the two methods. They found that the presence and severity of hemolysis appeared to have a significant impact. As the degree of hemolysis in the blood samples increased, the difference between the symmetric dimethylarginine results from the enzyme-linked immunosorbent assay and the liquid chromatography-tandem mass spectrometry method decreased. In contrast, no significant association was found between the presence of lipemia and the difference in symmetric dimethylarginine measurements. The concentration of asymmetric dimethylarginine showed a weak positive relationship with the difference between the two methods, but this was not statistically significant. In the subgroup of dogs where glomerular filtration rate was estimated using the plasma exogenous creatinine clearance time test, the researchers observed a weak, non-significant trend toward a larger difference in symmetric dimethylarginine concentrations between the two methods in dogs with lower filtration capacity. Moving on to the discussion of these findings. The study's results confirm that the liquid chromatography-tandem mass spectrometry method employed is a reliable and precise technique for measuring both symmetric dimethylarginine and asymmetric dimethylarginine in dogs, aligning with its designation as the gold standard. Notably, this robust method is also commercially available at a cost comparable to the enzyme-linked immunosorbent assay used in the study within Belgium. A key finding was the significant discrepancy observed in symmetric dimethylarginine concentrations between the enzyme-linked immunosorbent assay and the liquid chromatography-tandem mass spectrometry method in this population of older dogs, even though the general laboratory reference interval upper limit was the same for both. Although the average difference was relatively small in a substantial portion of the dogs, this difference exceeded a previously reported maximum acceptable variation for symmetric dimethylarginine measurements in cats. More importantly, in some dogs, the symmetric dimethylarginine concentration measured by the enzyme-linked immunosorbent assay was above the laboratory reference interval, while the result from the liquid chromatography-tandem mass spectrometry method for the same dog was within the reference interval. This highlights that the choice of measurement method could potentially lead to different clinical interpretations regarding a dog's kidney function. The researchers point out that using higher cutoff values for symmetric dimethylarginine, as suggested by earlier studies, or the age-specific upper reference interval identified in this research, could help to bridge this discrepancy between the two methods. This observation also aligns with recent updates to the International Renal Interest Society guidelines for staging kidney disease in animals, which have adjusted the symmetric dimethylarginine cutoff values based on the IDEX enzyme-linked immunosorbent assay. However, increasing these cutoff values might somewhat diminish the perceived advantage of symmetric dimethylarginine in detecting early declines in glomerular filtration rate compared to serum creatinine. The researchers discussed that poor agreement between liquid chromatography-tandem mass spectrometry and enzyme-linked immunosorbent assay methods has been reported for both asymmetric and symmetric dimethylarginine in human medicine. Studies in humans have shown that enzyme-linked immunosorbent assays tend to overestimate the concentrations of these substances, possibly due to the influence of the sample matrix on the assay. Furthermore, a fundamental limitation of enzyme-linked immunosorbent assays is their inability to distinguish L-arginine, a common amino acid, from symmetric dimethylarginine or asymmetric dimethylarginine, a capability that is unique to mass spectrometry-based methods. For distinguishing between different groups of samples, liquid chromatography-tandem mass spectrometry is therefore considered considerably more reliable in human medical research. Interestingly, the results of comparative studies between liquid chromatography-tandem mass spectrometry and the high-throughput enzyme-linked immunosorbent assay used in veterinary medicine have not been formally published in peer-reviewed scientific journals. The higher symmetric dimethylarginine concentrations observed with the enzyme-linked immunosorbent assay in this study underscore the critical importance of establishing method-specific reference intervals, rather than relying on extrapolations from existing data. The researchers emphasize that transferring reference intervals between different measurement methods should be avoided, especially when there is a systematic difference or bias between the methods or when differences in analytical quality exist. To understand the reasons behind the observed differences, the researchers evaluated the effect of potential interfering substances, namely asymmetric dimethylarginine concentration, hemolysis, and lipemia, on the symmetric dimethylarginine measurements. While a weak positive relationship was noted, the asymmetric dimethylarginine concentration did not have a significant effect on the obtained symmetric dimethylarginine concentrations. This finding is consistent with previous reports for liquid chromatography-tandem mass spectrometry, but comparable data for the enzyme-linked immunosorbent assay were previously unavailable. Prior research has also demonstrated that liquid chromatography-tandem mass spectrometry for symmetric dimethylarginine is not affected by the presence of arginine, monomethylarginine, and homocitrulline. The study found that the difference in symmetric dimethylarginine concentration between the two methods decreased with increasing hemolysis, suggesting that hemolysis might interfere with the enzyme-linked immunosorbent assay. However, no significant association was found with lipemia, possibly due to the limited number of samples with moderate to severe lipemia, which could be attributed to the fact that the dogs were fasted for the study. Previous work has shown the robustness of liquid chromatography-tandem mass spectrometry for symmetric dimethylarginine measurement, even with increasing levels of hemolysis or lipemia. Notably, in 3 samples, symmetric dimethylarginine could not be accurately measured by the enzyme-linked immunosorbent assay due to interfering lipemia or hemolysis, further indicating potential limitations of this method when analyzing such samples. The researchers caution that these observations regarding interference should be interpreted carefully, as the study was not specifically designed as an interference study and only a small number of dogs had high scores for hemolysis or lipemia. The effective glomerular filtration rate, estimated by plasma exogenous creatinine clearance time, on the difference in symmetric dimethylarginine concentration was also assessed in a smaller group of dogs. As expected in this group of dogs without overt kidney disease, all glomerular filtration rate results were within previously established weight-based reference intervals, which limited the ability to calculate strong correlations between glomerular filtration rate and symmetric dimethylarginine. However, a weak, non-significant trend toward a larger difference in symmetric dimethylarginine between the 2 methods was observed in dogs with lower filtration capacity. While the time interval between sampling for symmetric dimethylarginine and performing the plasma exogenous creatinine clearance time test was generally short, the inherent individual variability in symmetric dimethylarginine levels could potentially influence this observation. However, previous research has indicated that symmetric dimethylarginine concentrations tend to remain relatively stable over time in dogs. Overall, the study did not identify a single definitive cause for the consistent difference in symmetric dimethylarginine concentrations between the 2 measurement methods. Drawing upon findings in human medical literature, the researchers suggest that the most likely explanations are the presence of matrix interference in the enzyme-linked immunosorbent assay and the superior specificity of the liquid chromatography-tandem mass spectrometry method. Establishing an age-specific reference interval for this cohort of older dogs revealed a considerably higher upper limit for symmetric dimethylarginine, particularly for the enzyme-linked immunosorbent assay, when compared to general laboratory reference intervals. Several human studies have demonstrated a correlation between age and symmetric dimethylarginine levels, suggesting the potential need for age-adjusted cutoff values in humans. However, this link in humans may be related to the age-associated decline in glomerular filtration rate, which is less pronounced in aging dogs. In this canine study, because glomerular filtration rate was assessed in only a subset of dogs, the possibility of early-stage kidney disease in some included animals cannot be entirely ruled out. While measuring glomerular filtration rate using plasma exogenous creatinine clearance time is not practical for routine clinical use, the researchers excluded all dogs with overt kidney disease based on serum creatinine and urine-specific gravity to minimize this potential influence. They also considered the impact of muscle mass on serum creatinine, especially in older dogs, but based on muscle condition scores, misinterpretation of creatinine levels seemed unlikely. Although a few dogs with slightly elevated creatinine but well-concentrated urine were included, the researchers deemed the potential influence of prerenal azotemia, a condition related to dehydration, to be negligible in these cases. The inclusion of a few dogs on intermittent medication might also be a concern for reference interval determination, but recalculating the intervals without these dogs yielded the same results. The higher upper limit of symmetric dimethylarginine observed in the study's older dog population compared to a previously suggested cutoff for diagnosing decreasing renal function using the enzyme-linked immunosorbent assay in a younger adult dog population further emphasizes the need for age-specific reference intervals for various laboratory parameters in veterinary medicine. The researchers acknowledge some limitations to their study. They did not have a comparable reference interval established at the same institution using younger and middle-aged dogs. Also, the number of very large or giant breed dogs included was small, which might mean the study population is not fully representative of the entire geriatric dog population. However, they note that symmetric dimethylarginine is generally considered not to be significantly influenced by lean body mass or breed, with the exception of greyhounds, suggesting that the impact on the obtained reference intervals is likely minimal. The researchers recommend that the suggested age-specific reference intervals should ideally be validated in a larger and more diverse population of dogs, but emphasize the crucial need to use reference intervals that are appropriate for the specific population being evaluated. Previous research has indicated a degree of analytical variability with the enzyme-linked immunosorbent assay method. While individual sample analysis was performed for this method in the study, the intra-assay variability reported by the primary laboratory for a large number of samples was relatively low, suggesting minimal immediate interference. Although batch analysis was done for the liquid chromatography-tandem mass spectrometry method, but not for the enzyme-linked immunosorbent assay, which could theoretically introduce some bias. Recent data suggests that the influence of differences in storage conditions and storage time on symmetric dimethylarginine levels is minimal. Studies have confirmed the stability of symmetric dimethylarginine under various storage conditions, making it unlikely that storage differences were responsible for the observed discrepancies between the two measurement methods in the study. In conclusion, this research demonstrates that the commercially available liquid chromatography-tandem mass spectrometry method described is a valid and reliable technique for measuring serum symmetric dimethylarginine in dogs. The study clearly highlights that significantly higher symmetric dimethylarginine concentrations are obtained using the enzyme-linked immunosorbent assay compared to liquid chromatography-tandem mass spectrometry in older dogs, strongly indicating the necessity for method-specific or device-specific reference intervals. Finally, and importantly for veterinary practice, the study establishes that the upper limits of the age-specific reference intervals for symmetric dimethylarginine in older dogs without kidney disease are substantially higher for both methods compared to general laboratory reference intervals. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.